Dear colleagues, dear friends, I'm really honored today to inaugurate this fourth Congress of the Tunisian Association of CBT under the theme of CBT for the Family. For this event, I chose to entitle this inaugural conference From Psychoeducation to Family Therapy, How Can CBT Support Families with Psychological Pain? And this choice was on purpose to introduce the major part of the Congress topics and to provide the audience a global view of the recent literature about this specific field. For the introduction, we can say that people are in continuous transaction with their environment. Family is the closest people environment and obviously the most important one. Every member functioning is involved in the establishment of the whole family functioning, what's we call in psychology the family system. Naturally, every system tends toward equilibrium. Thereby, in the context of psychological distress, this family equilibrium could be a vulnerability source of mental disorder occurrence, or at least a maintenance or an exacerbation factor. On the contrary, this family equilibrium could be a stabilizing factor or even a source of resilience. CBT, as renowned, is a structured and effective therapy which can help families undergoing psychological distress find out and figure out family system dysfunctions. In fact, CBT is able to enhance every family member awareness of his dysfunctional behaviors in a non-judgmental atmosphere, and this is the advantage of CBT. And also, it is able to expose psychological processes that lead to suffering in a pedagogic way. CBT can also provide the necessary tools and skills to overcome or at least to alleviate the psychological distress within the family. This is possible through a variety of family CBT intervention like psychoeducation, skill trainings, or even a structured cognitive behavior family intervention. All what I'm saying seems coherent and promising, but actually CBT is a based evidence treatment, and we have to refer our conclusions about this specific field to scientific study proofs and literature recommendation. For that, in this lecture, is going to try to spotlight based evidences of cognitive behavior family interventions. And for the beginning, let's have an idea about what the literature says about family involvement in mental health. And to tackle this field, I'm going to start by the positive aspect of the family and talk about its role in resilience. The American Psychological Society defines resilience as a process of bouncing back from difficult experiences, pardon, and adapting well in face of adversity, trauma, tragedy, threats, or significant source of stress. This society considers family cohesion and uh, coherent attitudes toward life adversity and daily life stress as an important factor of the establishment of member resilience and consequently of the prevention of mental disorder occurrence. Uh, Nowadays, this resilience concept is no longer an exclusive psychodynamic one. CBT processes and techniques can certainly play a substantial role in the building of resilience. In fact, a recent systematic review and meta-analysis of psychotherapeutic intervention for resilience, published by Joyce et al. In 2018, has found that the most rigorous trials and those which have shown effectiveness in improving participants' resilience were studies with CBT approaches inter alia mindfulness protocol, like you can see on this slide. Some other authors, uh, like Werner, Lebeau, and recently Walsh, think that a person's resilience requires a specific family functioning that provides support to each other, fosters communication which each member, establishes autonomy and independence for members, creates flexible and valuable rules governing conducts within the family, teaches ability to adapt with environment changes, um, and finally builds capacities to become more proactive to avert crises. Here we can notice that all these learning goals accord with fundamental CBT principle and processes. Let's move now to the family as a risk factor. As a risk factor, parents, because of some certain way of bringing up with their children, are involved in the development and occurrence of some child, adolescent, and youth mental disorders. A systematic review and meta-analysis conducted by Hugh Yap et al. In 2014 has shown in a large sample of young people ranging between 12 and 18 years old that those who have received an education with less warmth, more interparental conflict, over involvement of their parents in their life, aversiveness and punishment, less autonomy, guaranteeing and monitoring, were more likely to develop anxiety and major depressive disorders. This kind of evidences has led to the development of some specific psychotherapeutic intervention for parents, especially cognitive behavior parent interventions for some child and adolescent mental disorders. In literature, there are strong evidences that family plays an important role in psychological distress of family members. Family is strongly implicated in both triggering, maintaining, and worsening of mental disorders. These proofs justify the development of many family intervention, especially cognitive behavior, family-based intervention for many adult mental disorders. If we look now family from another perspective, we will notice that it can be crossed by many specific painful events that make family members at high risk of psychological distress. From these painful events, we can particularly mention severe mental disorder, bereavement, suicide within the family, infertility and adoption condition, infidelity and adultery, life-compromising disease, sexual, physical abuse, and environment harassment, and so forth. In the literature, many programs with CBT strategies have been proposed and tested to support families with this kind of psychological pain. Now, let's move on to the most important part of this lecture and talk about all these different family interventions. Literature distinguishes three kinds of intervention. Cognitive behavior couple therapy that are interested or intended for partners, cognitive behavior parent interventions. They are provided to parents, and here we can find actually two kinds of therapies. Those tested to prevent the occurrence of mental disorders among children, adolescents, and youth, and especially on most of them for those at high risk of depression, like those with family history of depression or mood disorders, and those tested to improve the outcome of pre-existing child and adolescent disorders. The third sort of intervention is cognitive behavior family-based intervention. They are conceptualized to involve family members in the treatment of their relative mental disorders. Let's start with cognitive behavior therapy for couples. A review undertaken by 2015 has distinguished three kinds of interventions. Those intended for improving relationship and reducing distress between partners. Here, Fisher et al. Have found in this review that CBT is substantially effective. There are those provided to couple to help one partner at managing his or her specific medical condition. And here Fisher and Cole have noticed that results were so inconsistent and very complicated to be rigorously interpreted. Finally, there are couple therapy intended to improve one of the partner's mental disorder, and this is the more interesting one. And let's expand on this third kind of cognitive behavior couple therapy. At first, there is a primary review about cognitive behavior couple therapy for depressive partner published by Barbato in 2018. And this review has noticed that the comparison of cognitive behavior couple therapy with no or minimal treatment, no treatment or minimal treatment, showed a large significant effect of this therapy for both depressive symptom level and depression from measured, and remission, and all remissions, the rates of remission from measured depressive episodes. However, there was no evidence of difference in the effect at the end of treatment between cognitive behavior couple therapy and individual therapy in measured depressive disorder remission, either for the continuous outcome of depressive symptoms. Nevertheless, in the specific condition of postpartum depression, Ngaye et al. Have conducted a multi-site randomized controlled trial and have shown that couple-based cognitive behavior intervention effectiveness was significantly superior to women alone intervention on measured depressive episode and depressive symptoms at 6 weeks. Authors conclude that involving the partner during this specific context is very gainful for both mother and baby. Uh, Another positive effect of cognitive behavior couple therapy among women is on the second row of the table. You can see it, uh, where you can notice that for women premenstrual disorders, cognitive behavior couple therapy seems more effective than one-to-one therapy on women coping with stress and also their management of the relationship with their partners. Now, for gambling problems, Nilsson uh, et al. In 2019 has noticed that through 12-week internet CBT intervention, cognitive behavior couple therapy was as effective as one-to-one therapy on gambling problems, but significantly more effective to motivate the gambler to commit psychopharmacological follow-up following the intervention. Regarding drug and alcohol misuse, an old review conducted by Foss Stewart et al. In 2004 has already concluded that the involvement of the partner in cognitive behavior therapy reduced significantly the use of substances and improved relationships within the family. A randomized controlled trial assessing the effectiveness of cognitive behavior couple intervention among partners with diagnosis of anxiety disorders has found no difference between couple intervention and pharmacotherapy plus psychoeducation regarding the anxiety disorder improvement. However, the couple intervention, which is a CBT for the anxious partner and a behavior marital therapy, has better improved scores in quality of life and marital adjustment scales. Finally, I would like to make you notice that cognitive behavior couple therapy seems not only effective for some mental disorders, but also in some particular life couple issues. For example, Fredrickson et al. Have shown in a recent meta-analysis that cognitive behavior couple therapy can significantly raise the infertile couple chances of procreation. And that is a very amazing result. We finished now with the first kind of family CBT, and let's move now to cognitive behavior parent intervention. Like I've said earlier, some parents' cognitive behavior intervention aim to parent child and adolescent mental disorders. Some others try to involve parents within structured therapy in the management of their child mental disorder. Cognitive behavior interventions can include psychoeducation about the child mental disorder, cognitive and behavior traditional techniques, mindfulness protocols, behavioral enactment with some specific exercise like completing a craft, using board games or playing theater games, like suggested by Fredberg in his publication in 2006. And these specific techniques offer live experiences during sessions and help both therapists and parents to find out and to be aware of the dysfunctional behaviors and beliefs. Here is a rigorous and very exhaustive meta-analysis concluded by Hetrick et al. In 2015 and has shown a positive effect of cognitive behavior parent interventions in reducing depressive symptoms and also future depressive episodes among children and adolescents, with um, even the maintaining of these results at 9 and 12 months after the intervention. Um, this effect was more robust and targeted than in universal stages. And I mean by targeted ones, those conducted within population at high risk of depression, like, for example, children with family history of depression. On the other side, current literature uh, find that for anxiety disorder and psychoses, results are more uncertain or without any evidences of effect. However, one new study is still underway and seems promising. It is conducted by an Australian team and aimed to investigate combined individual and family cognitive behavioral therapy, the IFCBT, for people at risk of developing psychosis. Another new protocol is also underway to prevent ASD, autism syndrome disorder, with acceptance and commitment therapy provided for both parent and the child. Let's talk now about the second kind of cognitive behavior parent intervention, which aimed to involve parent in their child mental disorder. Regarding the most famous child mental disorders, we can notice in literature that, like it is noted on the first row of this table, there are a few studies which have examined this kind of intervention among children with ASD. In addition, these few reported trials are often biased, and we couldn't retain their results. On the contrary, there are at least two rigorous randomized controlled trials about cognitive behavior parent therapies among children with ADHD. The first one has shown a significant improvement in ADHD symptoms and child self-esteem. The second is underway in China, and it is using mindfulness for both parents and child. Regarding child anxiety disorders, this review of Bannier concludes that cognitive behavior parent intervention are not only as effective as individual therapies, but also enhance the child response and improve children social functioning. In this same review, some studies have shown significant reduction of anxiety scores when cognitive behavior parent interventions were provided to children with ASD or ADHD. For now, child and adolescent mood disorders, serious randomized and controlled studies show a significant reduction of mood symptoms and improvement in episode remissions with child family focused cognitive behavior therapy, the CFF-CBT. These interventions included psychoeducation about the mood disorder, mindfulness techniques, and also interpersonal family techniques what were that were tailored to the specific therapeutic needs of families affected by mood disorders. Mm, Overall, about all this literature for children or child and adolescent disorders, we can say that literature validates the efficacy of family focused CBDs for child mood and anxiety disorders. However, the effectiveness is less robust when compared to active control conditions, and unfortunately, studies that compared parent CBT to individual one are very rare. Here we reach the last sort of cognitive family therapies. Here, therapies provided to the family are mostly a comprehensive model toward the parents and are based on an overall psychoeducation about the member mental disorder, on problem-solving strategies against stress and some specific situation related to the patient mental disorder, on emotion management, inter alia with mindfulness techniques, on cognitive restructuring about patient behaviors and symptoms, and finally on communication skill within the family. As you can see on this table, here researchers were more interested by appraising family intervention among patients with severe mental disorder, especially schizophrenia, bipolar disorder, and OCD. In these conditions, it is already known that patients with family environment that express higher level of criticism, hostility, or over-involvement have poorer outcomes and have more frequent relapses. A review conducted by Okpokoro and al. In 2014 has shown no effect evidence of schizophrenic patients' outcome of brief family interventions. Nevertheless, this kind of intervention was significantly gainful for family members to show better understanding toward the patients. Another study undertaken by Kai et al. Has shown that the schizophrenic patient undergoing comprehensive family therapy showed greater improvement from baseline to the follow-up assessments in cognitive function than those in the usual daily care group. This result was true not only for the global score, but also for immediate memory, attention, visual-spatial skills, and language scores. Regarding now bipolar disorder, a recent meta-analysis published in the British Journal of Psychiatry has appraised the effect of psychosocial intervention in addition to pharmacotherapy among bipolar patients. The study has found out that therapies for family members were the unique interventions that reduce relapses risk. For OCD, the results of Thompson et al. Meta-analysis suggest a large overall effect on OCD symptoms and global functioning of family-inclusive treatment, which is also kind of comprehensive model toward patients. In addition, this therapy family inclusive treatment, which targeted family accommodation of patient symptoms, was associated with better scores of patient in the GAF, the Global Assessment Functioning. Finally, and surprisingly, current literature suggests that there are no evidence of superior benefit of family CBT among patients with anxiety disorder or those with eating disorders. Um, in this last part of the inaugural conference, I would like to briefly talk about specific CBT intervention that support families undergoing the adversity, life adversity. Life adversity like severe mental disorder among family members, suicide within the family, infertility and adoption, infidelity, adultery, life compromising diseases, and all these topics will be treated tomorrow in this Congress. The other life adversity can be bereavement, child with chronic illness, sexual and physical abuse within the family, environment harassment, and maybe more others. One. It's already known and proved that when a family member have a chronic and severe mental disorder like ASD, psychosis, ADHD, chronic depression, or Alzheimer dementia, the family risk of psychological distress and mental disorder is significantly higher than the general population. Since uh, the late 80s, the family support and advocacy movement in children and youth's mental health, especially children and youth mental health, have been evolving, especially in Europe and USA. Nowadays, many psychotherapeutic programs exist, and they can be provided by trained families who have already experienced this adversity. And we can mention parent empowerment program or parent to parent program too, or provided by clinicians. And here is the list of intervention published in a review of the topic undertaken by Hogwood, where we can notice that the majority of intervention were based on CBT. Regarding other advocacy undergone by the family, many papers have been published in this field, and most of them concur with the fact that CBT is at least as effective as other therapies to alleviate family pain. Nevertheless, further studies are still needed with larger effectives and more relevant scales assessing the specific family distress caused by this kind of event. And this therapy intervention, they are mainly focused, the interventions are mainly focused on three axes. There is the cognitive restructuring by discussing members' attribution in order to smooth down their common feelings of especially guilt, and by constructing rational meaning to life according to the current troublesome life event. Second, emotional management by working on acceptance of the current situation and by providing a lot of understanding to the family and many compassion skills. And finally, behavior activation by guiding every member of the family, guiding their behavior toward their own values, all the things that they consider that important in their life as person and things. In conclusion, there is sufficient today, I think, scientific evidence to conclude that CBT strategy that enhance the caregiving capacity of family members of people with mental disorders have clinically significant impact on the course of major mental disorders. However, the accurate positive impact of cognitive behavior family intervention must be determined by further studies with specifically the use of individual therapy control groups. To date, the CBT parent intervention for children at risk of mental disorders are only efficient for depressive disorders. Some new promising cognitive behavior family intervention for psychosis and ASD are still underway and can bring more hope for these two severe mental disorders. Finally, interventions against many specific like adversity are enough codified and seem effective. However, further studies are still needed with larger effectives and more relevant scale assessing the specific distress caused by the event. Um, at the end, I can say that further CBT research could allocate more interest and financial resources for parents, couple, and family-based intervention in order to justify their possibly dissemination through wide health programs. Uh, Thank you for your attention.